I've actually done a number of these events. You find that some of them actually relate, or if not all of them, relate to the brief that we take under Health, Social Services and Public Safety. It's a big committee, it's a big brief, we deal with a lot of issues. And I think it is, this particular subject is timely. You know, as a committee we are looking at the needs of children and young people and better outcomes for them. So we are always interested to hear other research or indeed research from here. But I personally want to add that I couldn't do my job in this building without the hard work and determination, and sometimes how the research in here gets some of the information amazes me. But it's a genuine partnership approach to the work that I try and do as an MLA and indeed as chair of the committee, and the work that the research services do in here. So as I say, we couldn't do our work without that, and I want to thank you for that. We came out of a committee meeting yesterday, which it was a paper that Leslie Ann prepared on cancelled hospital appointments, which was cancelled by the hospital. So we're actually digging into that more deeper. The issue of the executive and indeed government policy in general does put a strong emphasis on giving children the best start in life, and I think that's important. Recently my committee conducted a review in the whole issue of health inequalities and the outcomes in health inequalities, with a particular focus on early years. And I was quite keen that we done that review rather than an inquiry, because an inquiry, as you know, can go on either anything from months to years. I just wanted to do a short, sharp review on the issue of health inequalities, because inequalities in constituencies hasn't changed. In fact, in some of the issues, the inequalities have gotten worse. While we are getting better in some of the things, the areas that suffer more from health inequalities haven't changed over the last number of years. So I wanted to focus on early years, so that we are in there at an early level, that we're in there with intervention earlier if needed, and has better outcomes in the long run. And we did hear from a range of people, including expert witnesses. We learned valuable lessons about how approaches are taken in other countries. And we did come up with a final report. It was only 9 recommendations, which is due to be debated in 2 weeks in the Assembly. But as a committee, we were very conscious, pardon me, and we wanted to look at it in a sense, a more radical approach, and look outside of the boundaries. And we are the scrutiny committee for the Department of Health and Social Services. But if people look beyond this, other departments, if not all the departments, have an impact and should have an impact on children and young people. So we have made a recommendation that the executive should give strong consideration to setting up a department for children and young people. And we believe that will ensure that services are designed around the needs of the child, whether that's services from agriculture and rural development, whether that's services from enterprise, trade and investment, education, social development, and so on. The Health Committee has also taken evidence regarding the forthcoming mental capacity bill, and an important part of this work is the issue of under-16s in the context of the new bill. And we have done some engagement with the stakeholders, and we've had research briefings on that. Although we haven't taken a final decision on the issue, we're looking forward to further discussions as the bill progresses, and that will be a joint piece of work, as I say, with the Justice Committee up here as well. We have looked at a number of other issues relating to family life, including children who live in the care system, kinship carers, and some kinship carers, unfortunately, are also children themselves. The adoption process, without politicising it, child protection, and we've also had a keen interest in the services available to children throughout the North. As part of this, we've been very, very focal on the issue of children's paediatric cardiac care, and indeed we've brought a motion to the Assembly saying that we need to be exploring the issue of all-island approach to this. Why should our kids have to be flown to England for an operation when part of the review recommendation says that our transport shouldn't be looked at as an option for kids in England. We did visit the Clark Clinic, so we could see at first hand the work that goes on in the Royal Victoria Hospital, to see how children are cared for there. So given the important role that the childcare research plays, not only in terms of policy development, but giving the voice to children, I am delighted that Dr. Laura Dunne is here to talk about more about her research. You probably all know that Dr. Dunne is a senior research fellow at the Institute for Childcare Research at Queen's University. She has completed several extensive research projects, which we will hear about in the course of her presentation. She actually started when she was 3, so she's still very young. So I am interested to hear and to see Laura's presentation, and I wish you well. So thank you.
Thank you very much, Sue, and thanks very much, Leslie-Anne. And thanks to everybody for coming today to hear a bit about the Institute of Childcare Research. We're based at Queen's University Belfast, and we've been around for almost 17 years now. We employ some 27 staff, and some of my colleagues are here today, and hopefully they'll be able to contribute to question time afterwards and fill in some of the gaps that I'll likely leave. I had planned to talk a little bit about the work of the Institute today. We're a very, very broad church in terms of what we do, and for that reason I probably can't go into a lot of detail on every one of the themes that we work on, but I hope to tell you, do a sort of whistle-stop tour of the work that we do and illustrate some examples along the way, and then you can feel free to ask any of us about further details later on. The mission of the Institute is to generate knowledge through research to serve children. That's what we exist to do. We're always evolving, changing, responding to new questions and new need. So just to set the scene, we have a population of around 1.8 million in Northern Ireland, and roughly a quarter of the population are under the age of 18. 1 in 4 of them live below the poverty line, and there's around 2,500 of those who are looked after at any time. A lot of the research in the 80s and early 90s focused on the Troubles, and the focus on children's social care research was fairly minimal at that time. So the Institute of Childcare Research was founded in 1995, and this was really as a direct response to demand from the children's sector in Northern Ireland. The original mandate was to examine the implementation of the Children's Order, and anybody who remembers that time, the Children's Order brought about a sea change in terms of philosophy, legality, research, and how the state and families interacted with regard to children. We now generate in the Institute an annual income of about £1 million per year, which we use to answer topical research questions. Like I said earlier, we're responsive. Our structures are in place to link with the children's sector at all times. We founded in 2004, and we continue to host the Childcare Research Forum. This was set up to form a sort of cross-cutting research culture, and we try to engage with academics, practitioners, stakeholders from all across Northern Ireland and all sorts of different places, anywhere that we are serving children. We also have a Made in Northern Ireland conference, and when we do that, we also publish a book of abstracts from that, and people have fed back to us saying that this is a wonderful resource. It's almost like an index book where people working in any place in Northern Ireland know who the go-to people are to speak to about any children's issue they may wish to know more about. About 2/3 of the projects that we do are generated by ongoing consultations, and I'll give you a couple of nice examples of that as I go along, and the remaining third is driven by the need for basic research. So within the ICCR, our work programme is organised around 5 themes. Now, these are often changing because they don't always fit neatly into the categories that we have, so we have to respond to that as well. We have considerable experience in evaluation, and by that I mean evaluating services or interventions for children. We also teach. We contribute to the teaching of the School of Sociology, Social Policy and Social Work, And we were also instrumental in setting up the D-Child, which is a taught doctorate in childhood studies, which is unique. And in our first few years is proving extremely popular, and we're getting great feedback on that. In terms of review, the Cochrane Developmental, Psychosocial and Learning Problems Group is housed in ICCR and has been since 2010. This is a wonderful thing to have at Queen's University, and it's one of over 50 Cochrane research groups. And Cochrane reviews would be considered to be the gold standard in review research. So that is also part of our work remit. And it looks at, any of these reviews look at the effectiveness of health and social care interventions for children. So I'll start off with my own theme, which is children and families. And over the last 10 years that I've been at ICCR, we've used all sorts of different methodologies. We've tried all sorts of things to find out how things are for children at the moment. We've used qualitative, quantitative, mixed, longitudinal methods. We're always trying innovative methods, and I know some of my colleagues in the audience, we try to do maps of foods that children like and all sorts of engaging workbooks and games to play with children because, of course, they're happiest talking and doing. So we're always up for a challenge. Like I mentioned earlier, we continue, particularly in this theme, to evaluate interventions, and I'll give you a couple of examples of those in a moment. Our key aim is to inform policy and practice, and most of all, to improve outcomes for children in Northern Ireland. So just a few examples, key examples of work that has either recently been completed or is ongoing. In terms of sexual health work, I've just completed an evaluation of the Brooke Sexual Health Programme in Northern Ireland. We're currently writing up papers both about the sort of profiles of the young people attending Brooke and also about the kind of services that they sought and how effective they rated them. Also, I'm doing some work with UCD at the moment on a sexual health evaluation, looking at young people in care in the south of Ireland, and we're in the fieldwork phase of that at the moment. And again, this is a group of young people whose needs in adolescence are sometimes overlooked, so we're hoping to match up the correct interventions and services to those young people. We also carry out a number of randomised control trials, which in a social care setting can be quite a challenge, but we find that the evidence that they bring us is very powerful. One example of this is the Parenting Your Teen evaluation, which we carried out for Parenting NI. And this is a great example. The results are just in, they look promising. Already, Parenting NI has adapted some of their programme to build in our findings. And along with that, we've secured further funding to help deal with some of the questions that were raised throughout that evaluation. I also run the Life Start evaluation, which is an evaluation of the Life Start programme in the island of Ireland. It's a 6-year evaluation programme funded by the Atlantic Philanthropies. We're currently on sweep 3. Our children are 3 years old. They'll exit the programme at the age of 5. And again, this has never been done. The programme's in existence. It appears to work well. It should work well. But we are going to provide the evidence. We're going to be able to say whether it works or not. And we should also be able to tell how it works, what things work best, what things don't work. So they're the sort of evaluations that we're involved in at that end. In the education realm, I'm currently evaluating the Bernardo's Ready to Learn evaluation. I currently have 16 schools in the Greater Belfast area, in the most deprived areas actually of Greater Belfast. And these children in the intervention group are getting 3 afternoons a week of a literacy programme, which is a considerable duration, and they're getting that over a 3-year duration from P1 to P3. And they're now in P3. They've changed a lot since P1, as has their artwork, and when you bring their artwork back to them year on year, they deny they ever did the one from the year before, saying, no, only a baby would do that, I couldn't possibly do that. So we're learning an awful lot from those children. We're learning not just about the nuts and bolts of the standardised tests, how many words, how's their vocabulary coming along, what are they. We learn more about their lives, their situation. We're talking to their parents, we're talking to their teachers, we're talking to people in their community. And sometimes that's where, yes, we do need the statistical evidence and the number crunching to tell us does something work, yes or no. But it's actually engaging with those key people in a child's life that gives us that rich story underneath it all to find out from parents, children, teachers, what would work, what doesn't work, why is this a good idea? how could we improve upon it? So that's just a flavour of some of the work ongoing. We have carried out longitudinal work in the past, such as the Growth, Learning and Development Study in Belfast, which was followed up then by the Growing Up Study. We bring training that is bespoke and unique to Belfast, such as the Triangle training, which we brought to Queen's, which trains people in how to communicate with disabled young people. The Triangle, we made such a good connection with Triangle that they actually premiered their new DVD, Communications, a Three-Way Street, with us in the Institute. We get invitations to join service design groups, special interest groups, like Sue was talking about there, about the appointment system for children, the Paris system. We were invited to join and give some input to that. And most recently, we've had some input into the Northern Ireland infant feeding guidelines as well. So it's extremely important to us that our research is applied, that we convert our findings into information that is policy and practice relevant. The next theme of 5 that I wanted to give a brief flavour of was the foster care and adoption theme, and I have Dr. Dominic McSherry here with me today, and Dominic will be more than happy to talk to anybody afterward, and I hope I represent his theme well. I'm sure he'll let me know if I don't. The foster care and adoption theme is very much around understanding professional decision making for children in care and the children who are adopted from care in Northern Ireland. It also gives an insight into the court processes that are involved in gaining care orders, and importantly the long-term outcomes for all the children who are either in care or adopted. Dominic's work can be either cross-sectional or longitudinal in design, so we do look at the here and now, what's the state of play at the moment, but some of Dominic's work, as you'll hear, is quite unique in how long it's been going on. And again, we use both quantitative and qualitative data. So yes, we want the numbers, we want the state of play, but we also want the story behind it. And this theme is particularly good at developing innovative and engaging approaches, which I'll tell you about in a moment. And again, engaging children on any occasion can be challenging, but when they're from a particularly vulnerable group, or where they have had some difficult interactions in the past with grown-ups seeking information from them, it's all the more important that we have good techniques and good methods to engage them. This theme aims to conduct rigorous research that informs not only local but national and indeed international policymakers about what works well and not so well for the children in care and adopted. So, first of all, I'll tell you a little bit about the Care Pathways and Outcomes study. This is a study that has been running for over 10 years and has tracked the care placements of 374 children in Northern Ireland. It's unique, it hasn't been done anywhere else in the world. It looked at all of the children in care who are under the age of 5 in Northern Ireland in the year 2000. And the Pathways team went out and visited 77 of these families across a range of placement types. And the interesting thing is that some of these methods that I've spoken about, that the Pathways team developed, have now been adopted across the UK by many other eminent research teams who work with similar groups of children, and they were delighted to pick up on these methods and use them. So that's a real marker of success for us, that our work is being noticed and people are using it elsewhere. The sort of things that we look at in terms of these children are attachment, bonding, the contact they have with their birth families, social support, the child behaviour, health, education, self-esteem, and the parents' level of coping and stress. So again, we're getting a holistic picture of the family. Another project of interest that I'd like to highlight in this theme is the At Home in Care project, which is about children who are living with birth parents on a care order. These placements account for about a quarter of the care population in Northern Ireland. Now, when I first became aware of this work, I thought, well, hold on, isn't that very risky? You know, why place children in a situation where the source of risk may well be the parent? But like I said, this accounts for about 1 in 4 of the care population. So what the team set out to do was to look at the professional decision-making and outcomes for children and families in these cases. So they set about the very onerous job of reviewing the case files of 48 of the children in these situations, to look at the decision-making processes for the children, and to look at the sort of not just what happens when they're placed, but to follow them over time and look at the longer term outcomes and monitor how they get on with their move. This is a work in progress and will be followed up by direct interviews with the subsample of the children and the birth parents as well. Another very important piece of work in the foster care and adoption theme is the regional variations of placement. So this, and again, another important point about the work that we do in the Institute is that the work we do is always informing the next question. We never seem to put a full stop after work that we do, and particularly in this theme, it seems to open up more and more questions, as many questions as it answers indeed. And what we find is that there were marked variations in the placements being provided to children across the different health trusts in Northern Ireland. So in some trusts there was a real drive to adopt children, whereas in others there was a real foster culture. So the team thought it would be remiss to not look at this particular area, so they decided that they would explore the current extent of regional variation in Northern Ireland. And what they're doing is looking at care orders that were made 4 to 6 years previously and the reasons for apparent variations. So really you're looking at what is specified in the care plan and looking to see, did that actually happen? And if not, why not? What happened to these children? So again, the onerous task on the team is to review social work reports and care plans for 200 children for whom care orders were made between 2006 and 2008 across Northern Ireland. And this has been followed up then with telephone interviews. Again, we have to be very flexible. Many of the staff that we deal with in these situations are extremely overburdened with research requests and so on. So sometimes the team has to respond to that. Good solution in many cases is the telephone interview, and we're far more likely to engage with more of these social work staff and senior managers in that way. And finally, in this theme, the last project that I wanted to highlight is one which is very exciting and recently awarded by OFM DFM here, is the Mind Your Health study. And the team were very much informed by the work of Meltzer et al. In the UK 2003-2004 work, where they carried out a large-scale survey of health, both mental and physical health, on a large scale in the United Kingdom. The team decided that it was very important to set a Northern Ireland context. You have to remember that in Northern Ireland as well, we have the second highest uptake of antidepressant medication in Europe. So the study will aim to profile the different types of health problems that looked after children and young people experience in Northern Ireland, and also to look at the sort of services and initiatives being offered to improve these health outcomes. This will be done by carrying out focus group interviews with the trusts, with social work managers, also a telephone survey, which the team very ambitiously hopes to reach 650 carers across Northern Ireland. So there's going to be some very busy phone lines in that project in the very near future. In addition, they'll be carrying out face-to-face interviews with about 60 young people. And then the focus group interviews will be carried out with a range of professionals. So again, you can see the style of getting a very 360 view here of what the state of play is. And whenever I talk to Dominic and the team, they tell me that ultimately they want to impact on policy. They want to make sure that resources that are currently being used are being used for the right services for these young people. So in terms of impact, what impact has this theme had? Well, it's very widely cited. The work of this theme is very widely cited in social work and also by legal practitioners in care and adoption court proceedings. A range of initiatives across the trusts have also been influenced by this work, such as the Guide to Case Management in Public Law Proceedings, and also a greater focus on supporting parents when they go home from care in the Southern Trust. The theme leader, Dominic McSherry, has been appointed to BAF's Central Research Committee, and the Care Pathways and Outcomes study book is about to be published by the British Association for Adoption and Fostering. And Dominic tells me it's summer 2013, so long as he keeps working through the night. So he's been allowed out for a couple of hours. So moving on to the third of the 5 themes, I'd like to do, again, a very quick tour around the safeguarding theme and to look at a number of the areas that are covered under this. One is looking at case management reviews. The other is physical abuse and high-risk families. perinatal maternal disability and domestic violence, and also evidence synthesis. So again, just a brief and quick flavour of each of these. So in terms of learning from the case management reviews, in 2008, the Department of Health, Social Services and Public Safety commissioned Queen's and the NSPCC to evaluate the case management review system into non-accidental child deaths and serious child abuse. And the person cited here, Anne Lazenbat, who unfortunately couldn't be here today, is unique in her position in the Institute. It's the first appointment of its kind in the university. Anne is actually a joint appointment as a reader with NSPCC and Queen's. So she's in a very unique position to carry out research with us. The findings from the evaluation have already resulted in revisions to the policy guidance and processes of case management reviews in Northern Ireland, and also to the development of new training programmes for staff who are involved in these processes. So it's extremely important again for us that we see some of the results of the work that we do. In terms of physical abuse and high-risk families, the NSPCC again commissioned a scoping report to look at an evidence base for dealing with high-risk families. So what resulted from this was a report and a book which aims to increase our understanding of risk, analysis, impact, learning and the current landscape of service delivery in relation to physical abuse in high-risk families. Now, disability is a theme that the Institute is keen to support and keen to populate with studies. And I'll tell you a little bit about one of those with young people in a moment. But this is one in the safeguarding theme around perinatal maternal disability and domestic violence. And it also demonstrates nicely the kind of collaborations and partnerships that we have from quite a wide range of sources. So this collaboration is with Dundee, Queen's, NHS Fife, NSPCC and Scottish Women's Aid. And it was funded by WellBeing of Women and aims to address some gaps in our knowledge around perinatal health and well-being when disabled women have their babies, and these are women who have also suffered domestic abuse. So essentially we're looking at the relationship between disability, domestic abuse and access to maternity health care. The key questions that the team are asking in this case is looking around facilitators and barriers to accessing and utilising maternity services. How effective are the strategies that are used to enhance and to get women to access services? And when women are faced with difficulties, how do they overcome these barriers? And what, again, are the priority areas for improving access and utilisation? The fourth theme, then, is health and well-being. And this is led by Geraldine MacDonald in the Institute. And the aim of this particular theme is to examine the extent and nature of mental health problems and disability among children and young people. It also explores the quality and accessibility of services provided to meet need, and it has a particular focus on the co-occurrence of needs and the impact on longer-term outcomes. And finally, and possibly most importantly, looking at the effectiveness of services and policy initiatives in addressing needs. And I suppose a lot of our work is around that we do know that things are in place, but are they effective? So one of the examples that I said earlier that I would like to highlight around consultation and how we respond to need is the Wellbeing in the Lives of Disabled Adolescents project. And this is a project that came about because of consultation. The Institute was looking to explore what needed to be researched in terms of disability and young people. And a group of young people from the Sixth Sense group in Armagh was convened by the DHS SPS, and our team went to visit these young people. And they told us very strongly that it was extremely important that we look at some of the issues facing them in adolescence, particularly their emotional needs. And this is work that hasn't been done here before. It's a qualitative piece of work. It's very in-depth, and it tells the stories of a number of young people in Northern Ireland living with disability. And I suppose some of the things we're starting to find is that the sort of career and education opportunities afforded to them are based sometimes on what's available and not based on what they want to do or on their aspirations, need or desire. So there are some really interesting findings emerging from that at the moment. Another piece of work under this theme is the grief study. And this is using administrative data, linked data, to look at the factors that affect how people cope after bereavement. And these can be things like age, gender, where you live, education, family support. The Institute also completed one of 5 Bamford Rapid Reviews on mental health and learning disabilities. These reviews are extremely useful, and I know a number of people here today were involved in them, because they provide a real evidence base, they provide a state of play, and they also are useful for commissioners and stakeholders in deciding what research needs to be done next. We also carry out a large number of systematic reviews, and these basically give us a state of the evidence at any given time on any given topic. Another interesting project that is ongoing in this theme is the Measure project, which is looking at the main constructs of measuring autistic spectrum disorder. And I suppose the ultimate aim of that will be to provide us with knowledge, with a battery of tools that we can use in monitoring the progress of ASD in children and young people. So now on to the final theme, which is youth development, lifestyles and social behaviour. And I hope that some of you may have been at our BIDS conference last month in Queen's, where we had Professor Sir Michael Rutter come over to chair this very important flagship piece of work in the Institute. The Belfast Youth Development Study has been going on for over 10 years. We also explore teenage drinking cultures and young people at risk of problematic drug use. So they would be, now there are a lot of spin-off projects that have come out of this study over the years, but they would be the main key areas at the moment. So behind most of this theme, we're looking at the causal mechanisms that explain the developmental course of problem behaviour and mental health problems, both for children and for adolescents. We're also interested in how problem behaviour in adolescence kind of impacts later on. So how can that problems in your adolescence affect your own later parenting, impact on your own offspring when you're grown up? So we're really looking at mechanisms of intergenerational transmission in that case. We're very lucky in the Institute that we have a number of excellent statisticians working with us who are always looking for the more nuanced findings, who are always digging a bit deeper and looking for the story under the headline. The Belfast Youth Development Study, which we all refer to as BIDS, began in 2001, and it's looking at children and young people from 11 years now up to 21 years of age. And it's unique again in its size, its duration, and in the depth and quality of data that it has collected. So we had 5,000 young people from 43 schools in Belfast, Ballymena and Downpatrick. And they completed every wave self-reported questionnaires on behaviour, family, peer, school, neighbourhood, all sorts of stuff about their lifestyle and things that were happening in their lives. So at the neighbourhood and school level, what sort of things were we learning from the BIDS data over the last 10 years? Well, we've been looking at variations in adolescents' heavy drinking across neighbourhoods and schools. We've been looking at relationships between neighbourhood deprivation and individual changes in patterns of substance abuse. So we do tend to get that in more deprived areas, you get higher levels of drinking at a younger age. But we have an apparent paradox arising now in terms of affluence, where we are finding that more affluent young people tend to have more risky early drinking behaviours. So in terms of dangerous early drinking behaviours, we're talking about things like blacking out, like family and medical people, at an early stage flagging up their problem drinking behaviour. So there does seem to be this apparent paradox with more affluent young people. The influence of the neighbourhood social and leisure facilities is extremely important, and we're starting to find out now that there's a big mitigating effect of membership to a club, to a sporting activity, regular attendance at sporting activities in mitigating substance and alcohol abuse at a younger age. We're also looking at the school influence on substance use, so how the school ethos affects adolescents' drinking, smoking and illicit drug use. And one of the findings is we're finding that the higher level of conflict with teachers in a school is indicative of higher levels of substance abuse. So this slide just highlights another 3 projects, and again, not going into any detail on them, but they're very, very interesting, and they're the sort of work that we're at the cutting edge of developing and researching in the Institute. So, for example, in terms of offending behaviour, we have identified a number of trajectories in offending behaviour. And yes, as expected, there is a persistent trajectory of young people who get into offending behaviour and find it very hard to exit that. But there's also evidence of young people who mature in and out of offending behaviour. So some people start young, then leave offending behaviour. Others seem to have a nice trajectory and then go into offending behaviour. And again, this is the sort of stuff that is under investigation at the moment in the Institute. We're also looking at the socioeconomic influences. So again, the things like deprivation and higher alcohol and substance abuse. And we're also looking at the family, peer and school processes in the development of resilience to drinking among young people in Northern Ireland. Now, this is an interesting piece of work, looking at the longitudinal work and the causal mechanisms between parent-child interactions and drinking behaviour during adolescence. And it highlights nicely some of the statistical work that's going on all the time. So this is looking at the effect of parental attachment and parental monitoring on young people's drinking. So at first look, statistically, you would think that good attachment would mean a good relationship with your child and less chance of substance abuse. And also parental monitoring. So if you're watching your child like a hawk and they can't get up to any mischief, you should be safe enough too. But one of the things that's emerging from the data is that where you have very good attachment, sometimes the parent, because of the good attachment, takes their eye off the monitoring to an extent. So the young person then is exposed to chances to get involved in substance abuse at an earlier age. So there's something quite nuanced going on there, and it's trying to work out what is the perfect blend of monitoring and attachment. And I'm really hoping they come up with the answer before my children become teenagers, because I probably need it. You can see also that some of our key areas of research are around the long-term use of substances such as ecstasy, and we're also looking for the patterns and risk factors in terms of heavy cannabis use in adolescents. And of course, we're looking at how familial factors help young people cope after bereavement. So what I'd like to finish up with are 2 quotes, and these mean a lot to us in the Institute because it means that we're doing what we aim to do and hopefully doing our job well. Brian Dornan from the Health and Social Care Trust was talking about the regional variations work that Dominic McSherry was responsible for. And because this work, he says, not only made us aware of the differences in practices in different trusts, it demonstrated the impact on children themselves and indeed the stress levels of their carers on different care arrangements. So that tells us that at that level our messages are getting through. And then finally, Sean Holland was talking about the 10-year strategy for children and young people and said that the Institute have continued to cluster the research around those high-level outcomes, making sure their work continues to be relevant and support future policy development. And I suppose that really sums up what we try to do as an institute. We do want to create wonderful research, carry out rigorous research and provide good evidence for policy practitioners, but above all to serve children. Thank you very much.